Okay, welcome to the deep dive.
It's great to be here.
Today, we are taking a deep dive into a stack of sources all about stress and its effects on our bodies. We all feel stress, right?
Oh, absolutely.
And it often feels like it's making us sick. But what does the science actually say? Can stress, cause serious diseases?
Or does it just make conditions we already have feel worse? That's a key question.
Yeah.
And fascinatingly, the sources suggest that sometimes the link to stress is surprisingly weak, sort of challenges what we think we know.
Absolutely. So our mission today is to, well, cut through the noise, dive into these sources, and pull out the key findings supported by the evidence presented here,
Right. We'll look at where the link seems strong
where it's maybe a bit mixed.
and where, like I said, the evidence for a direct cause is, well, maybe not what you'd expect.
Mm-hmm. The material mentioned that example of Marty, remember? Headaches, then stomach issues, then cancer.
Yeah, and he kept asking, could this all be stress? Why me?
That really gets to the heart of it for a lot of people, doesn't it?
It really does.
So let's unpack the stack of sources. Let's see what the evidence actually tells us about the real impact of stress on our health.
Okay. Where should we start? The strong evidence.
Yeah, let's start there. Conditions where stress seems to play a pretty clear part. And the first place we absolutely have to start, based on this material, is cardiovascular disease, CVD.
Right. The sources highlight that diseases of the heart, blood vessels,
Hmm.
particularly coronary heart disease, CHD, they're the leading cause of death.
For both men and women in the U.S.
Yeah. And there was that figure, wasn't there, showing how after about age 75, CVD deaths really shoot past cancer deaths.
Yeah, significantly. It's a huge health challenge. So how does stress fit into this? The sources link it right to atherosclerosis.
That's that gradual narrowing and hardening of the arteries.
Exactly.
Okay, so think of your artery lining, right? That inner wall. The sources suggest stress can actually contribute to the start of the damage there, like irritating the lining. And this irritation, so like a signal, kicks off inflammation. Immune cells show up.
White blood cells.
Yep, and they start gobbling up that bad cholesterol, the LDL.
So stress kind of helps open the door for that initial injury.
That seems to be the idea. And as these immune cells fill up with fat, they become foam cells, and they become part of a plaque.
Ah, the plaque.
And it builds inside the artery wall. The sources called it like an intra-arterial pimple.
Okay, vivid.
Yeah, and this plaque just keeps growing. It attracts more inflammatory cells, lipids. The artery narrows, gets stiffer, arteriosclerosis.
And the heart attack, the big event, that happens when the plaque breaks open.
Exactly. If it ruptures, the body tries to form a clot to stop the bleeding, but the artery's already narrowed, right?
So the clot blocks everything.
Blocks the blood flow.
Ah,
And that leads to heart muscle damage, heart attack, myocardial infarction, or sometimes sudden cardiac death.
the sources also gave those examples. Rhonda and Humberto showed how different heart attack symptoms can be.
Yeah, Rhonda had the jaw pain, nausea, dizziness, sort of atypical, especially for women.
Compared to Humberto's classic elephant on my chest, left arm tingling.
Right. It underscores how varied it can be. And the material touched on demographics, too.
Like higher rates of hypertension in African Americans, but slightly lower diagnosed CHD than whites, though, sadly, higher death rates.
Uh-huh. And Hispanics showing lower rates of both CHD and death from it compared to non-Hispanic whites. It's complex.
Okay, so beyond that initial damage,
Yeah.
how does stress directly impact things like blood pressure?
Oh, there's a clear connection shown in the sources. Acute stress, like a sudden shock getting stuck in traffic.
Yeah, blood pressure spikes.
Exactly. But chronic stress, long-term stuff, a bad marriage, financial worries that can stop your blood pressure from coming back down to normal afterwards.
So it keeps your system kind of revved up all the time.
Yes. And people who already have high blood pressure, the sources define that as 140 over 90 or higher.
Essential hypertension.
Right. They seem to show a stronger blood pressure reaction to stressors.
And that constant high pressure is bad news long term.
Definitely. It causes structural changes to blood vessels, the heart, raises the risk for heart failure, stroke, all that serious stuff.
What about stress and cholesterol? The sources said that was more complicated.
Yeah, it is a bit messy. There's that classic old study, right, to tax accountants' cholesterol up before the deadline.
I remember hearing about that one.
But later studies have had really mixed results. Some even found emotional distress linked to lower cholesterol.
Oh, really? Okay.
But importantly, the sources do indicate that stress management seems to help reduce lipid levels, particularly in men who already have CHD. There was a study mentioned, Dobin-Mayer.
So managing stress could still be part of the picture for improving cholesterol, especially if you're already at risk.
That's what the evidence here suggests, yeah. Now, when we look at sudden cardiac death, SCD,
That abrupt loss of consciousness.
yeah, the link to acute stress becomes pretty dramatic in some examples. Sometimes happens even without prior diagnosed heart issues.
The sources had those impactful stories from Engel's work, didn't they? The man shouting, collapsing.
The woman hearing about her sister's death.
The man dying the day after his wife's funeral. Just awful.
Yeah, Engel categorized them personal danger, death of a close person, acute grief. Reviews mentioned found that people prone to this often had recent major losses or were very anxious or hostile, maybe socially isolated.
And acute stressors can definitely be triggers. The sources cited the LA Northridge earthquake.
SCDs jumped from like 4.6 a day to 24.
Wow. And Scud missile attacks in Israel, heart attack deaths doubled.
Even stressful soccer matches, more than double the risk in one study.
So intense, acute stress can push vulnerable people over the edge.
It really seems so. And emotion plays a huge part. Anger, hostility, the increased stress hormones, catecholamines,
Blood pressure, heart rate.
platelet aggregation makes blood clot easier,
Mm.
and all that can disrupt those plaques we talked about.
Triggering a heart attack or SCD.
Exactly. Anger and hostility are flagged as significant independent risk factors.
Independent, okay.
Anxiety might be a stronger predictor for women, the sources noted, and depression. That's clearly identified as an independent risk factor, too.
For developing heart disease and for worse outcomes if you already have it.
Right. And the sources mentioned that chronic stress and depression seem to directly stimulate pro-inflammatory cytokines. That feeds right into the heart disease process.
So it's really those distress emotions, anger, hostility, anxiety, sadness, that have the closest links in this material.
That's the picture painted here. And other long-term stress factors play a role, too, like ACEs, adverse childhood experiences.
Right, linked to greater heart disease risk decades later. Dose-dependent, even?
Yeah, the idea proposed is ACEs lead to negative emotions, anger, maybe depression, which triggers physiological responses and maybe unhealthy behaviors later on.
It's a long shadow. And work stress.
Yep. Cardiac arrest, more common on Mondays, suggests maybe that return to work stress.
Job strain, low job control. What did they call it?
Low decision latitude. Basically, having little say in how you do your job. That and low social support at work.
Low decision latitude was a consistent predictor.
Yeah, I mentioned the Framingham study, clerical workers versus managers. Clerical workers had double the risk.
Wow.
And a big meta-analysis linked work stress overall to about a 50% increased risk of CHD. Long-term shift work also ups the risk.
And lower socioeconomic status is in there too. Makes sense. Probably linked to more stress, fewer resources.
Seems logical. And just to show it's not only negative stress.
Oh, yeah, the positive excitement thing.
Right, even extreme positive excitement can trigger SCD, the man who died after his first hole-in-one.
Incredible. So it's the intensity of the emotional or physical shock.
That seems to be the key trigger for vulnerable systems. Emotional stress, anger, extreme excitement, physical exertion, primary triggers.
That's surprising, but it makes a kind of sense. Now, the good news?
Yes, the good news for these sources. Heart attack risk is largely modifiable.
Over 90%, according to that Interheart study. That's huge.
It really is. And the
Yep.
sources list those key factors we can change.
Not smoking, huge one. Eating fruits and vegetables. Exercising more.
Lowering cholesterol, controlling obesity, especially abdominal obesity, preventing diabetes.
Managing stress, there it is again. Preventing high blood pressure. And alcohol.
Yeah, I mentioned moderate intake might decrease risk, but it's controversial. The AHA advises against starting to drink for heart health.
Got it. So the core pillars are really smoking avoidance, fruits and veggies, moderate activity, keeping lipids in check.
Those seem key. And for people who've already had an event,
Anxiety and depression are common afterwards, understandably.
and the sources show counseling helps. Cardiac rehab programs, too, those multi-part things with exercise, diet, stress management.
They're beneficial, show risk reduction.
Yes. Stress management specifically was linked to weight loss, lower triglycerides, even lower hostility in some programs,
And psychoeducational programs.
linked to reduced mortality and fewer non-fatal heart attacks later. Exercise-based rehab is strongly supported.
And the Ornish studies, lifestyle changes.
Yeah, that intensive program, low-fat vegetarian diet, quitting smoking, exercise, stress management, linked to reversal of artery narrowing in some early work.
Though replication on the reversal part was mixed.
Yeah, mixed on reversal specifically, but other benefits like slowing progression were found.
Yeah.
There was also the prostate cancer study showing lifestyle changes slowed progression there.
So overall, a very strong link for stress in cardiovascular disease, contributing to the start, triggering events, impacting recovery.
It seems deeply involved at multiple stages, according to this material.
Okay, let's shift gears. Skeletal muscle conditions. The sources also present strong evidence here.
Yes, and this one feels maybe a bit more intuitive, because we all know stress makes us tense up.
Right. Shoulders up by your ears.
Exactly. And the most common example is tension-type headaches, TTH.
Very common. Associated with muscle tension, head, neck, back.
And what's interesting is that people with TTH report more daily hassles, the everyday proximal stresses.
Not necessarily big life events, but the constant grind.
That's what the sources suggest seems more connected here. There was even a lab study where most TTH sufferers actually got a headache after doing a stressful task.
Wow. And they tend to be more pain sensitive overall.
That too, yeah.
Okay, how about migraines? They feel quite different.
You do. Neurovascular origin involves blood vessels, nerves, often one-sided pain, nausea, maybe those visual auras, more common in women.
And the stress link.
Their initial onset seems more linked to distal stress stuff from the more distant past. But once you're prone to them, stressful periods can definitely trigger attacks.
Makes sense. And then there's the jaw stuff, teeth grinding,
Bruxism.
and TMPDS, temporomandibular pain and dysfunction syndrome, pain in the jaw joint, chewing muscles.
Yeah, these also seem strongly stress-related.
Yeah.
TMPDS is often linked to high muscle tension there. Bruxism is associated with stressful days, anticipating stress, daily work stress,
And TMPDS.
linked to hyperactivity, spasms in the chewing muscles. Higher muscle tension even during rest, but especially under stress.
So definite connections. Stress, muscle tension, these pain conditions. What about coping?
For tension headaches, acute behavioral treatments like relaxation, biofeedback, they can work well.
Biofeedback helps you learn to control the tension.
Exactly. Combining biofeedback and relaxation, or using CBT stress management, especially with other treatments, seems effective. Often a mix of meds and non-drug approaches.
And for the bruxism, the TMPDS.
Oral appliances and night guards are really common. EMG biofeedback, learning to relax those specific jaw muscles, is beneficial. And combining the night guard with the biofeedback seems like the best behavioral approach according to these sources.
So learning to manage that muscle tension, maybe with some tech help, seems key.
Okay, third area with strong evidence, atopic disorders.
These are the immune system over-response conditions, right? Asthma, hay fever, eczema.
Exactly. Biological hypersensitivity, mucosal inflammation. Let's take asthma first. Chronic condition, acute attacks, inflammation, airways constrict.
And the sources mentioned a feedback loop.
Yeah, having an attack is stressful, and that stress can actually trigger more attacks.
Ugh, that sounds like a vicious cycle.
It really can be. And early stress exposure, general psychological distress, low social support, they're linking the sources to both future onset and the course of the illness.
So getting it and how bad it is.
Right. A meta-analysis found a bidirectional link. Having the disorder is linked to distress, and distress is linked back to how the disorder plays out.
Okay, so early or ongoing stress can make you more vulnerable and worsen symptoms. How do you manage these?
Well, avoidance is key triggers like smoke, pets, pollen, indoor pollution, dampness. For infants, breastfeeding might help.
Explain this psychologically.
Interestingly, the sources mentioned writing about stressful experiences showed benefits. Improved lung function in one asthma study.
Writing? Really? That's amazing.
Yeah, and stress management programs using writing, CBT, relaxation also improved lung function in young adults with asthma in another study.
Speaks to that mind-body connection again. What about allergic rhinitis? Hay fever.
The itchy nose, congestion, reaction to airborne allergens.
Springtime misery for many.
Totally. The sources link this to early stress exposure, too, like major life events in childhood, family conflicts.
And acute stress.
It seems to exacerbate the allergic reaction, makes it worse. One study showed anxiety actually made the welt bigger in an allergen skin prick test.
So stress doesn't cause the allergy, but it amps up the reaction when you are exposed.
That's what the evidence suggests. And atopic dermatitis, eczema, is similar. Skin hypersensitivity, inflammation, itching, scaling.
How does stress fit in there?
Stress seems to disrupt the balance of certain immune cells, T helper cells, favoring an inflammatory response, too much Th2.
So acute stress raising anxiety.
Can worsen symptoms by dysregulating the immune system, enhancing that Th2 response. And chronic stress also seems to push the immune balance toward that inflammatory type 2 response over time.
Coping involves avoidance, antihistamines, skincare.
Yeah. Sometimes meds like corticosteroids, Some strategies try to suppress the immune system or selectively adjust that Th1, Th2 balance.
Okay, so for these atopic conditions, stress seems strongly linked to vulnerability, especially early life stress, and definitely to making existing symptoms worse.
That's a good summary of the findings here.
Okay, let's move into the conditions where the sources say the evidence for a link to stress is, well, mixed.
And the big one here is cancer.
Right. Cancer, huge group of diseases, abnormal cell growth. Lung cancer is the leading cause of cancer death. And there's that really widespread popular belief, isn't there, that stress causes cancer?
There absolutely is.
Yeah.
But the sources here state quite clearly that the scientific evidence for stress causing cancer is mixed.
Mixed or weak?
Mixed to weak, I'd say, especially about the onset of cancer,
Yeah.
starting it.
Wow. Okay, that definitely pushes back against a common assumption. So where is there some evidence suggesting a link?
Well, some studies have found associations. There was one mentioned, German women, WWII trauma, suggested a dose-response link between trauma, especially loss, and later cancer risk. And some other studies link specific stressful life events to certain cancers. A possible mechanism they've explored is immunosuppression stress, maybe dampening down natural killer cells, NK cells, which help fight off cancer cells.
But that's not the main finding.
No. The sources really emphasize there seems to be more evidence for a link between stress and cancer progression, how it grows or spreads once it's there, than for stress causing it in the first place.
Ah, okay. Progression versus onset.
Exactly. And when researchers do those big meta-analyses combining studies, one found a moderate link between stress and developing breast cancer, but another found that link vanished when they only included the higher quality studies.
So the quality of the research matters a lot.
It does. And the overall conclusion presented in this material is that the strong popular belief about stress causing cancer onset just isn't strongly supported by the empirical evidence across the board.
Okay. Less about stress starting it, potentially more about influencing it once it's established.
That seems to be the distinction the sources are making. Even the animal studies, stress linked to tumor growth in mice. They're hard to generalize to humans. The mice are often bred specifically to get cancer or given huge doses of carcinogens.
Right, not quite the same situation. So stress causing cancer, mixed to weak evidence. What about prevention then, if stress isn't the main focus?
Exactly. The standard prevention strategies listed don't focus on stress. They emphasize screening, sun safety, healthy diet, healthy weight.
Obesity can help cancer cells grow.
Yeah, the sources mention that. Also, exercise linked to reduced risk for breast and colon cancer, avoiding tobacco, obviously huge, and limiting environmental carcinogens.
And they noted that just avoiding smoking and eating healthy could prevent more than half of cancers?
Over 50% of incidents, yeah. Pretty powerful.
Okay, so those are the established prevention routes. What about coping if you were diagnosed? Distress seems inevitable.
Absolutely. Worrying about the outcome is common. Psychological interventions often aim to help manage that anxiety, depression.
Does depression make cancer worse? That's another common idea.
The sources push back on that too. They point out cancer isn't necessarily linked to depression more strongly than other serious illnesses, and importantly, depression itself doesn't seem to cause or accelerate cancer progression based on the evidence reviewed here.
Okay, good to clarify. What about psychological help? Maybe helping people live longer with cancer?
There's research looking into that, like Spiegel's work suggesting psychotherapy benefits. But the sources add a note of caution.
Why?
Confounds. Meaning the groups getting therapy might have also received more medical care or attention overall. So it's hard to tease out if it was the therapy or the extra care making a difference in outcomes. Some studies also had statistical issues.
Ah, okay. So that link between therapy and longevity isn't definitively proven yet based on this material, but there were some more hopeful findings about interventions.
Yes, mindfulness-based stress reduction, MBSR, linked to reduced stress, lower cortisol, lower blood pressure, fewer inflammatory markers in breast and prostate cancer patients.
That sounds promising.
And CBT, stress management, associated with better immune function and early-stage breast cancer, linked to more positive emotions, even post-traumatic growth.
And the Ornish study came up again for prostate cancer.
Right. Men on watchful waiting. The intensive lifestyle group diet, supplements, stress management support saw PSA levels decrease, suggesting potential tumor regression. The control group's PSAs went up.
And their blood was better at fighting cancer cells in the lab.
Yeah, blood from the lifestyle group was significantly better at inhibiting lab cancer cell growth. So it suggests intensive lifestyle changes might slow progression.
Okay, summing up for cancer, Some suggested evidence that psych and lifestyle interventions offer immune and health benefits. Hopeful, but still speculative if they definitely lead to longer life at this stage. Evidence is mixed to weak for stress-causing onset, maybe stronger but still complex for stress-influencing progression.
That seems a fair summary of the sources, yes.
All right, let's move to the final category. Conditions where the sources find the evidence for stress playing a causal role is weak.
And first up here, the gastrointestinal system. GI stuff.
Like peptic ulcers. I swear, I always thought stress was the classic cause. Blame it on the boss, right?
That was absolutely the widespread belief for ages. Stress, diet, spicy food, lifestyle. But based on the sources here, the primary focus now, with strong evidence, is on H. pylori.
That bacteria.
Helicobacter pylori, yeah.
Yeah.
That's the main driver for most ulcers.
So it's an infection, not primarily stress.
That's what the evidence presented strongly supports. The bacteria infects and inflames the stomach lining or the duodenum, leading to ulcers. The sources are pretty clear. No definitive study proves a causal link between psychological stress and developing ulcers.
Wow. That's a major shift from the old narrative.
It really is. They do add a little caveat. A small percentage of ulcers not caused by H. pylori or NSAID pain relievers might have psychosocial factors involved, but they say more studies are definitely needed.
Okay, so peptic ulcers. Weak link for stress as a cause, despite the old belief. What about irritable bowel syndrome, IBS?
IBS. That's a functional disorder. No obvious physical cause on tests. Abdominal pain, tenderness, changes in bowel habits, constipation, diarrhea. Spastic colon is another name, more common in women.
And I know so many people with IBS feel stress makes it worse.
They absolutely do.
Yeah.
And that perception is really important here. While most patients believe stress plays a big role, the sources say the causal relationship is unclear.
Unclear how.
Well, chronic stress, more than acute stress, seems to impact onset and persistence. But studies looking specifically for stress-causing IBS onset found little support for that idea.
Even though people with IBS report more daily hassles, like with the tension headaches.
Exactly. The daily hassles are there, but the sources don't show them causing the IBS itself. The thinking presented is that daily hassles might exacerbate the symptoms.
Make them feel worse.
Right. And then having bad symptoms causes more stress. It's a cycle. But stress is explicitly stated in this material as not shown to be a contributive factor to the cause of IBS.
Okay, so stress can definitely make IBS symptoms flare up or feel worse, but it didn't give you IBS.
That's the distinction the sources draw. Now, inflammatory bowel disease, IBD, is different, more serious.
Crohn's, ulcerative colitis.
Right. Always involves visible inflammation, unlike IBS. Is the stress link stronger here?
What do the sources say?
Again, daily hassles seem more strongly linked to IBD symptoms than major life events. Daily stress exacerbates the symptoms and the psychological distress. But just like ulcers and IBS, the evidence for stress contributing to IBD disease onset is described as very weak.
So another one where stress worsens things but isn't shown as the initial cause.
That's a pattern across these GI conditions in the source material. Coping for ulcers involves antibiotics for H. pylori, maybe acid reducers, quitting smoking. IBS is about managing symptoms, finding triggers, which can include stress, so stress management might help if stress is a known trigger for you.
But the quality of IBS treatment studies isn't always great.
The sources noted that, yeah, for IBD, it's tailored meds, diet, sometimes surgery. Stress management is mentioned only if stress is a known vulnerability for symptom flares for that individual, because the evidence for broader benefit is weak.
Got it. So for GI, weak evidence stress causes ulcers, IBS, IBD, but strong likelihood it makes symptoms worse.
And finally, systemic autoimmune disorders, also categorized as having weak evidence for stress as a causal factor.
These are the ones where the immune system attacks the body's own tissues. Lupus SLE and rheumatoid arthritis RA.
Exactly. And the sources state pretty directly, stress is not shown to be a cause of autoimmune diseases.
Okay, another common assumption challenged. Let's start with SLE, lupus. Chronic, rarer antibodies attack organs.
Early observations did suggest stress might play a part in, triggering flares, recurrence, making it worse. But more recent reviews cited here say stress as a causal factor is not proved.
So it's an exacerbating factor.
Primarily, yes. An exacerbating factor for disease activity, and it definitely impacts quality of life.
So stress makes existing lupus symptoms worse, but didn't cause the lupus.
That's what this evidence indicates. And again, just like headaches and IBS, daily stress seems to hit harder than major life events in terms of making SLE symptoms worse, Prospective studies found daily stress best predicted how severe patients felt their symptoms were,
And studies on stress causing lupus.
deemed inadequate for conclusions in these sources.
Okay. What about rheumatoid arthritis, RA, chronic joint inflammation, damage?
Clinical observations also suggested a link there, but early studies were all over the place, contradictory. They looked into different theories, muscle tension, hormones, immune links, but the evidence back then was weak or inconsistent.
Has newer research clarified things?
A bit more, yes. For instance, a recent prospective study found that people with RA who had more negative life stress or more active disease or less social support, they were more sensitive. Daily stressors had a bigger impact on their pain and mood.
So vulnerabilities matter and how stress affects RA symptoms day to day.
Exactly. And acute stress is shown to increase those inflammatory markers in the blood, IL-6, CRP, stuff like that. And those are associated with RA flare-ups.
Okay, so acute stress clearly worsens inflammation and flares. Any evidence at all for stress causing RA?
There's some emerging evidence mentioned, but it's framed as very preliminary. Needs more work.
What kind of evidence?
One retrospective study found adults reporting childhood trauma were more likely to have been hospitalized for autoimmune diseases like RA decades later. Childhood trauma was also linked to inflammatory markers years later.
So maybe early trauma sets up a pro-inflammatory state.
That's the hypothesis.
Yeah.
But it was retrospective, people recalling past events. The sources stressed the need for more prospective studies before drawing strong conclusions about childhood stress being a direct cause of adult RA.
Okay. So for RA, strong evidence acute stress boosts inflammation linked to flares. Vulnerabilities amplify daily stress impact. Very limited emerging evidence for childhood stress, maybe playing a role in onset, but needs much more research.
That sums up the findings presented, yes. Coping for RA involves meds, sometimes surgery, behavioral approaches too, stress management, CBT, self-management programs.
Do they help?
Stress management showed some improvements: helplessness, self-efficacy, coping, pain, health status. CBT linked to less fatigue, depression, more active coping. Self-management programs showed smaller, short-term gains, sometimes not deemed clinically meaningful.
So these strategies can definitely help manage RA and cope better, even if stress wasn't the root cause.
Exactly. They address the impact of living with the condition.
So after diving into this whole stack of sources, what's the big picture takeaway here?
I think the main thing is just how complex the stress-health relationship really is, and how the evidence presented here really tries to distinguish between stress causing something versus stress making it worse.
Right. We saw strong links for stress damaging arteries, triggering heart issues,
Contributing to tension headaches, jaw pain.
making you more vulnerable to asthma, allergies, and worsening those symptoms.
But then for cancer, the evidence for stress causing it is mixed to weak. Maybe stronger for influencing progression, but still complex.
And for things like ulcers, IBS, IBD, lupus, RA, the evidence for stress being the direct cause is weak.
Even though, and this is key, stress often makes the experience of having those conditions feel significantly worse.
Yeah, that's what I find so fascinating. Our own experience often matches that exacerbation part perfectly, right? We feel like stress is making us sick because it is making our symptoms feel worse.
Exactly. Remember, the IBS patients who were sure stress played a role. The evidence supports stress making their symptoms worse, even if it didn't start the IBS itself.
That distinction between cause and exacerbation feels really important.
It is, and it leads to a really interesting question, maybe something for you, the listener, to think about. Given that being sick is inherently stressful, and stress can make many conditions feel worse, and our perception of stress and symptoms is so powerful, how much this whole stress illness picture is a kind of complex feedback loop?
Where the stress of being sick actually makes the sickness feel worse, kind of regardless of what kicked it all off in the first place?
Exactly. How much is that loop driving our experience?
Yeah. It's a powerful feedback loop to consider. Definitely something to mull over as you go about your day.